And the first area I'm going to pay attention to is the maxillae. And the maxillary arch will broaden in flexion and contract in extension, will widen in the flexion phase and narrow in extension. So this is an area where dental work and so on can produce quite severe traumas and lesions, and also blows to the face and frontal impact. So the first thing I'm going to do is to test for symmetry of flexion and extension, and I'm going to test for any shearing movements, any asymmetry there, and then the ability to come clear in a frontal direction, anterior direction, become loose. Then I'm going to monitor the movement of the vomer, which is right here, and the contact for the anterior vomer is right behind the front teeth, and the vomer comes cephalad into flexion as the greater wings of the sphenoid nosedive towards it, and that's the flexion movement. In extension, the posterior vomer, I move my finger contact to just in front of the cruciate area, and the posterior vomer goes superior in the extension phase. So flexion, the anterior vomer goes superior. In extension, the posterior vomer goes superior. One can also test for torsioning of the vomer, which is quite common, and stabilizing the greater wings of the sphenoid, I can introduce from the anterior angle, the anterior position, the vomer to go to the left or to the right. The next thing I'm interested in is the hamulus, just behind the back teeth. Stabilize the sphenoid area. Ask the patient to open the mouth and just to drop the fingers down along the line of the teeth with the palmar surfaces of the fingers pointing cephalad. And now I'm testing for flexion, and the arch is widening in flexion. Now I'm going to shift my position to lay my fingers along the maxillary arch on the right. I bring the finger slightly medially. As it comes into flexion again, I'm encouraging that side of the arch to widen towards Kim's right. And there's a very nice widening. As I come into extension, I will exaggerate the extension movement by holding my fingers together, as it were, and resisting the flexion movement. I will do this through several cycles of flexion extension until a release occurs. The next area I'm interested in is the vomer. Once again, contacting the wings of the sphenoid with my opposing hand, I insert one finger just behind the top teeth. I wait. She's swinging into extension now. The anterior vomer is coming down, chordad, pauses, and now I'm slightly exaggerating the flexion phase, where the anterior vomer is going cephalad and the greater wings of the sphenoid are nosediving chordad. So those two landmarks are coming together, and there's a release there. Now my next point of contact is on the pterygoids, on the hamulus, and I'm just coming behind the posterior molars here and a little bit medially. I'm reinforcing my contact on the same side. In this case it is Kim's right. And then I'm waiting until it comes cephalad. There's a very nice releasing movement. The next one I'm interested in are the palatines, and I'll contact a little bit further back than the posterior vomer, and to one side of the midline, and I will do the palatines last because usually all the other maneuvers intraorally will decrease pressure, and any pressure from rhinitis or sinusitis or any of these allied conditions will be relieved. Now I'm going to finish with the CV4, which is compression of the fourth ventricle. This is an excellent shotgun technique. It actually helps to increase fluid flow all over the body. So it looks like this. I've settled the occiput between the thenar eminences now. I'm feeling the flexion phase coming up. The cranium is swelling, the occiput is swelling between my hands, broadening into flexion. There's a pause, and I'm now following it into its extension phase. My thenar eminences are traveling closer together, and now it's reached the end of the excursion of movement. I'm up against the barrier, and I'm resisting it broadening into flexion once again. There's quite a deep feeling of relaxation introduced. This technique will relax the diaphragm. It will reduce a fever over a course of half an hour by up to 10 or 20 degrees Fahrenheit. It can reduce blood pressure by at least 10 points. As I said, very, very good shotgun technique. There it is. There's the still point. Still going on. There's a feeling of deep relaxation in the patient, and the breathing cycle starts up again. Sometimes there's an involuntary deep sigh. But it all feels perfectly relaxing and is perfectly safe. The only contraindications to the CV4 are where there is any evidence of tumour or pathology that would increase intracranial pressure, or any embolism. Well, that completes the series of moves for the cranium, and it's all a very rewarding form of therapy, especially in infants. However, it is very beneficial in a wide range of patients and situations, from mere physical tension to more serious pathology. So that completes this demonstration. Thank you very much.